Hey everyone, in this video I would like to share with you Harry's first experience with eczema flare-up. This was how his face looked like in the morning when we woke up. It was all dry, flaky, and some parts are weeping, and it was already smelling like an infection was starting. And this is the one after he had a bath. We brought him back to the doctor since 2 days ago we were there. And when the doctor saw his condition, she suggested that it will be best to bring Harry to the children's hospital so that someone from dermatology could look at him. During that day, except for the condition on his face, Harry was all normal. He was energetic and jolly, no fever, wasn't showing any sign of pain or discomfort, and his milk intake and consumption was like on the regular days. We already experienced that Harry had some redness and rashes on his face near his second month. The doctor prescribed this Dermaid gentle formula to relieve inflammation and itching. This is Harry's picture during the 24th of December and the next day, Christmas Day, and his face was still clean. But around December 28th and onwards, his face, especially the cheeks and around the chin, was starting to get rough and red again, and he loved scratching it. I even tried preventing him from scratching his face by kind of tying him up. And on January 8th, we decided to have him looked again by the doctor. And look at his face, he's having at first we thought it's allergic reaction, like the one that happened to him last month. But then when we brought him to the doctor this morning, the doctor reckons that it's not an allergic reaction at all because it's only localized on his face, unlike the last month that when he had the red ones on his face, it includes the whole body where he's got rashes and redness as well. But for this one, he's having it only on his cheeks and not around the face, so he only suggested a moisturizer to be applied on his face as long as it's needed. There was a big difference in terms of the redness compared to this morning. It's no longer the reddish, and he's no longer scratching his face vigorously like the ones he does from yesterday and this morning. But on the 10th of January, that was when the flare-up happened. It was heartbreaking to see him like that, but he was really cute though. He was stung by a bee. So in the hospital, they applied and prescribed to us this Advantan. This one needs a script before you can buy, and it is stronger than the Dermaid. Then we had to use this potassium permanganate diluted in water as an antibacterial wash for his face until it was clear. And we use it now once a week in his bath water to kind of disinfect his skin. Also, the nurse from the derma told us that Harry's skin needs constant moisturizing, so we have to buy this Epiderm and apply it daily to his face and to the whole body. And here's the transformation and result. I think on the third day of the treatment, that infected smell was still there and kind of lingers in the nose. And Harry's face was all clear 5 days after, and it looked like nothing happened. So that's it. That was our first experience with eczema flare-up. The GP told us that maybe it will flare up again within these first 6 months and might go away after that one. So hopefully it will really go away. If not, so we'll just have to deal with it in terms of prevention and management. Thank you for watching.